Afternoon, everybody. It's hot up here, and I have a hot pink shirt on. Okay. All right. So today we're going to speak about some misconceptions about physicians and how to implement some preventative care in the workplace. So, brief overview of the agenda, cost of care, just about how chronic conditions are spending up a lot of employees' healthcare benefits and costs and how this is kind of detrimental to the healthcare system. Naturopathic medicine, which is my specialty, to speak briefly about holistic care and how we can put this into the workplace and how it's beneficial. And then the big question after all this talk is how do we bring it home? How do we make it practical? How do we bring this preventative care into the workplace? So that's me when I had my afro. Changed it up a little bit for summer. So I'm a doctor of naturopathic medicine. I studied at the National University of Natural Medicine. Any specialty? Apparently I don't have a specialty. Thanks, Megan. And I got my Bachelor of Science at the University of Houston. And I'm a personal trainer and a yoga teacher. I heard earlier y'all did push-ups, right? Y'all did push-up? So I'm holistic, so we have to work the whole body. So everyone stand up. We're going to do some squats now. Lower body. Come on, y'all. Stand up, stand up, stand up. We're going to go for 10. Just do it at your own pace. Go ahead. Let's go. Just at your own pace. You just got to get the blood flowing. Okay? Good job. Good. Keep the chest up, chest open. Okay, after you're 10, you can have a seat. I don't want anybody to pass out. All right. Okay, great. Moving along. So, cost of care, green for the money, cost. Right. Did y'all get that? Okay, I'll have to go back on that slide. So, chronic conditions. So, people are suffering from chronic conditions. If you look at the list that the World Health Organization has put out of the top 10 diseases that kill people, at least half of them are chronic conditions and have a direct correlation to lifestyle and basically diet and nutritional type of things. So this is where we can see some great strides of improvement. So $8,000 spent on chronic conditions per person, poor nutrition, physical activity, bad habits like drinking alcohol, smoking excessively leads to these chronic conditions, which causes a lot of healthcare spending. And then 75% of all medical costs are due to chronic conditions. So augmenting this point some more, about 60% of medical expenses are driven by avoidable or unnecessary utilization. Again, diet and lifestyle habits, physical inactivity, poor dietary habits, smoking, drinking. And then going on the other side, on the other end, like the provider end, people getting referred to the wrong provider. And as we all know, the heavy overutilization of prescription drugs is a big expense, the expense of site of care, and then the inefficient protocol use. Sometimes us as physicians and in the healthcare model, we just kind of follow a protocol, but not taking the time to really listen to the patient and understanding where they're at, which can cost a lot of money. The state of health, I think this was a survey put out this year, actually. So the state of Oregon is ranked 31st based on these parameters: social, financial, purpose, and physical. And we actually had to change this slide because last year we were ranked 24th or 23rd, so we're actually going down. So that means we all need to step up a little bit. These parameters: social, how you feel about your job, how you feel about your community; financial, people were asked how they feel about their financial fitness. You know, do they have enough money to do things? Do they feel like if there was an emergency they'd be able to take care of that or cover that cost? Their purpose in life, and then the physical portion. You know, do you feel like you can get out there and do what you need to do and not be inhibited by any pathology? And we're ranked 31st, so y'all need to step your game up, okay? Primary care physicians. When we think about primary care physicians, also termed PCP, or this is like the general doctor that you go to see and not a specialist, they see about 2,500 patients, 20 daily appointments, and the face-to-face time with the doctor is quite limited, 8 to 10 minutes. And then the entire appointment is about 15 to 20 minutes. So by a show of hands, who does this ring true with? The actual time that you see the doctor is quite short. Okay, good. It's pretty consistent with these figures. Then how does this impact the employee cost of care? So about 10% of healthcare costs are spent on unnecessary services. That goes back to not addressing these conditions and preventing them on the front end. So then on the back end, we're spending more money on things that we could have prevented. Difficulty paying medical bills. Of course, not a lot of people have a couple grand in the bank to spend on a medical emergency, which is what makes this so important, because if we can deal with it on the front end, then we don't have to deal with that acute pathology that costs a lot of money, and then it's a big emergency. Health problems impact productivity. So about 25% of employers' investment in total compensation is spent on healthcare problems that can hinder work productivity. Again, this just ties right back into chronic conditions. Okay. And then the theme of today, the why. So why is it important to have on-site preventative care? We'll touch on some of these points. It improves access to healthcare. If you have a physician or a nutritionist or any kind of preventative wellness person on site, it improves the access to care. Then the employee doesn't have to make an appointment. They don't have to go out. Someone's right there to help treat them. Promoting preventative care services. When you have someone on site on a weekly, bi-weekly, or even a monthly basis, it kind of changes the culture and the dynamic of the workplace. So people are talking about health more. People are talking about put that donut down, pick up the apple kind of a thing. Reducing healthcare spending. Of course, if we're working on the preventative end, again, just kind of reiterating, then we're not spending a lot of money on those high-dollar acute care situations. Increase in productivity. If you have less sick days, then you can work more. Some people might not want to do that, but and then reduce lost time from work. Again, if you're not sick and you're productive and you're happy, you're at work more. So these are some of the results. There's some physicians are already starting this throughout the nation, and this was a survey taken with the employees and their satisfaction of having an actual doctor on site. So 87% were satisfied with having this medical provider on site. 63% reduction in absentee rates, so less people were missing time from work. 58% reported that having the on-site physician helped them to control their chronic condition, and then 54% reduction in modifiable health risks. Naturopathic, what vegetable is that? Beautiful work. Okay, so we have pictures of two doctors here. Which one is the naturopath and which one is the allopath or the medical doctor? Can we guess? What's that? The left one is which one? Okay. The left one is I don't know. Let's see what that is. Okay, this is supposed to be a joke that you can't tell the difference between the two. Megan, come on. We got to coordinate a little bit better with our jokes. Okay. Next time. Okay, so we're going to talk a little bit about my profession, my trade, naturopathic medicine. Supposed to be some witch doctor stuff, Megan. Okay. So a myth is that naturopaths can't prescribe medication. This is false. So oftentimes when I go to speak to people or I see a patient, they'll say, are you a real doctor? And what they really want to know is, can I prescribe medication? And that's true. So if you come see me, I can get you your Xanax, and I can get you all that stuff. Don't worry about it. That's not the first, second, or third choice, but we do have that ability. We take 2 years of pharmacology, so we're well-versed in all that, okay? Xanax is safe. Next myth, medical doctors and naturopathic doctors are at war. This is a big one. Some people think, if I have a naturopath, then I can't tell my medical doctor that I have a naturopath. Or if I have a medical doctor, I don't want to go to a naturopath because, they're going to have differing ideas. This is not true at all. I work in close contact with about 2 or 3 medical doctors, even up at OHSU. We bounce ideas off of each other. What's this? How do we do this? Phone consults. And it helps to coordinate. It just creates some continuity of care with the client or with the patient. And then final myth, alternative medicine is not as effective as pharmaceutical drugs. This is another big one. We get, can this plant really take my headache away? My knee hurts. Yeah, I need an injection. You just want me to drink a tea? Is that really going to work? Yes, it does. Okay. MD versus ND. So education. The amount of actual classroom hours is nearly identical. So a medical doctor goes to school for 4 years. Naturopath goes to school for 4 years. Residency. There's a little bit difference here. So medical doctors are federally funded in residency programs. So they have specialties, whether it be radiology, nephrology, cardiology. Naturopaths, we're privately funded, so the pool of residencies is much smaller. So most of the time when you see a naturopath, will be a primary care physician or like a general physician. specialty. Again, naturopaths kind of focus on the preventative side of care, medical doctors as well, but more often than not, they're kind of doing a reactionary thing. I feel bad, here's the pill. I feel bad, take the shot, which is totally needed, but just a little bit different in how we specialize. And then finally, areas of focus, just kind of reiterating. Naturopaths more on the front end, MDs more on the back end, but there's certainly some crossover there as well. Acute versus chronic care. Okay, so we're going to kind of break down what's an acute situation versus a chronic situation. So an acute situation is something that's going to end or resolve quickly. So this is a picture of a broken arm, but let me give you something more graphic. Let's say if somebody cut their wrist off and their hand is off and they're bleeding. This situation is going to resolve quickly. Either they're going to die or they're going to get that hand sewn back on, but this can't last for a long time. So it's going to resolve quickly. So when we talk about acute care, it's more an emergent thing, and it's going to hurry up and be over some kind of way. Okay? You like that one? All right. Pregnancy is not a pathology, but it's an acute situation. Again, you can't stay pregnant forever. Like it's something that's just going to happen. You can keep getting pregnant, but you can't stay pregnant forever. Okay? Then we're moving on to chronic. So headaches. So people can have chronic headaches, chronic migraines, meaning that it might not necessarily take you to the emergency room, but you can have this for years, 10, 20, 30 years of headaches, and it doesn't resolve quickly. You can have it for a very long time. Very similarly with high blood pressure. High blood pressure, it can turn into an acute state where you might need to go to the hospital or the emergency room, but many people suffer from high blood pressure for many, many years. And this is another important point to highlight is a lot of chronic care situations can turn acute, right? So if we don't deal with this chronic issue and we let it fester and fester, then it turns into a really big acute situation, and that's where costs go up. That's where everyone gets scared. We're going to the ER. Not a good situation. Okay, naturopathic medicine. So these are the 6 tenets that we go by as naturopaths, as wellness physicians. The healing power of nature. We certainly believe, know, and understand that nature and the human body has an innate ability to heal itself. So we follow nature and we follow the body. We try not to go against what the body is doing. We trust what the body is doing. So an example would be if I have a runny nose and my nose is running and it's green and yellow and pus filled and it's coming out, I'm not going to take a decongestant. I don't want to stop that. The body's trying to release it. So going with nature, going with the body, I'm going to try and promote that. Same thing with the cough. If I'm coughing out yellow and green mucus, no way I'm going to take a cough suppressant. The body is telling me I don't want this, so I'm going to promote that. Just a little bit difference of philosophy there. Identify and treat the causes. So a good example is like root knowledge versus like branch knowledge is what we call it. So branch knowledge is I have an apple tree and one apple is bad. Symptom treatment or branch knowledge would be just to cut that branch off. And then eventually that bad apple is going to come again, right? Treating the cause or the root knowledge would be let's check the soil, let's check the other trees. Is the tree getting enough sunlight? Is the tree getting enough water? We really take our time and try to find the real issue as just as opposed to symptom treatment. Do no harm. It's pretty self-explanatory. We don't want to hurt anybody. Doctor as teacher. So again, if we're dealing with the preventative side, and more especially in the case of naturopaths, we're actually taking time and having a lot of face time with the patient, explaining, this is what this lab means. This is what this test means. This is what your liver does. This is why I'm doing this. As opposed to the more traditional 5 or 10 quick visit, here's the prescription and go home. Treat the whole person. This one is really key. So if I see a patient and I just see a mom, let's say, and let's say she has diabetes and I'm working on diet, exercise, lifestyle with her, and then she goes home and her husband and her 3 kids are like, Mom, candy, ice cream, sugar, cake, that's going to be really hard. So when we treat the whole person, we mean them as themselves and then treating the whole extended branch of their family. Asking the parents to come in, asking the spouse to come in to help kind of coordinate this care. Because even after you leave the doctor's office, you still have to keep these goals in mind. And then prevention, kind of the whole focus of this talk is working on the front end, not waiting until something gets into an emergency type of state before we deal with it. So ND treatment types. These are just kind of a brief overview of kind of the things that we deal with and specialize in. So acute and chronic disease patients, more especially chronic disease. We're trying to deal with those top 10 killers, the ones that are affecting us the most in the world. Preventative care, we are able to prescribe medication once again. Stress management, this kind of ties into treating the whole person. So I'm not just giving, an herb instead of a prescription drug. I may be giving an exercise regimen. I may be giving a breathing regimen. I may be saying, hey, maybe you should talk to your mom about that thing you've been harboring for the last 15 years. Maybe this is why you have that headache. So we look at the whole person, we look at the whole family, dealing again with the whole tree. Lifestyle counseling ties into that. And then homeopathy, it's a kind of old school, very subtle type medicine that we use to deal with emotional conditions. So anytime I see a patient and I come up and develop a treatment plan, we go through something called a PAR-Q. Okay? So the P in PAR-Q is plan. So an example would be if I was treating someone who had type 2 diabetes, my plan would be, let's work on our diet, let's exercise, let's take a couple cooking classes, let's see if we can help out in this way. So this would be the plan, and I would clearly explain this to the patient. Okay? Then we move to the A, which is the alternative. So I'd give them the alternative. I can say, instead of doing this plan, I can prescribe you 500 milligrams of metformin twice a day. This would be the alternative to the plan. And then R is the risks. So I'll give them the risk to both the plan and the alternative, right? So the risk for the alternative plan would be you'll be less inclined to change your behavior if I just give you the pill and your hemoglobin A1C goes down or your blood sugar goes down, right? The risk of the plan would be you might have to join a gym, you might have to sweat a little bit, you might have to learn how to cook, you might have to get your butt in gear a little bit. That's not necessarily a risk, that's a good thing. And then the Q is for questions. So this is the time I can ask questions to the patient asks questions to me, and there's just a clear line of communication. When the person leaves my office, or if I'm doing some on-site stuff and they leave the room, they know exactly what's going on. It's not like, oh, my doctor just said everything was okay. They have a chance to ask questions. I have a chance to ask them questions. Roadblocks, what can hinder you? You don't like brown rice? Okay, let's start talking about some other things. This ties into my specialty actually is in botanical medicine. So this ties into the slide that we saw earlier that plants are not as effective as prescription drugs. So we've all taken aspirin or know somebody who takes aspirin, right? Non-steroidal anti-inflammatory, also a blood thinner. People use it for pain. But the main active ingredient in aspirin is salicylic acid, which is derived from Salix alba, which is the white willow tree. So incidentally, if you have cramps, you can just drink some white willow tea and then cramps are gone, 100%. Hydrastin. This is what we call a hemostatic, so something to stop bleeding. This is derived from the plant Hydrastis canadensis, or golden seal. So this is often used when someone's bleeding. You can put it topically. This is something that we see in hospitals and doctors' offices, but it's derived from this plant, from this tree. It's really bitter. I have some if y'all want to try. And then we all know about morphine, big painkiller. We've all heard about it. I know some people use it. This comes from opium poppy. This comes from the plant. So this really, really effective painkiller is actually derived from a plant. So this kind of just gives us a look into the fact that the majority of these prescription drugs that we think are so powerful and wonderful and strong acting actually come from plants, right? The beautiful thing about plants is that I'm not just isolating one part of it. I'm taking the whole plant and its family, right? I'm treating holistically. Now, this is time for me to brag on myself. Okay, so this is some case studies. This young lady was suffering from a condition called dermatographism. Derma meaning skin, graph meaning to write, like graphics, right? So basically she has hives that are so badass that she can write on them. She can write her name on them, right? So it's pretty intense. So every 24 hours she has to take Zyrtec. And she went to her doctor, and the doctor was like, you're really lucky that you just have to take Zyrtec every 24 hours. She's like, no, I don't want to do that. So we got her on a treatment plan, changed the way she showered, gave her some herbs, gave her some teas, gave her some breathing exercises, and now she's taking instead of taking the Zyrtec every 24 hours, she's taking it just once a week. So that's a huge, huge improvement for her. Then this is a case of, I was dealing with a young girl, she was about 7 years old. She had a really bad ear infection, pus, blood coming out of the ear. Her mom took her to their general physician. They wanted to prescribe her amoxicillin, which is a common antibiotic. Her mom was like, no, I'm not into antibiotics. So basically we took an onion and wrapped it around her head, and we changed it's like an onion dressing, we call it a poultice. So we changed it about every 4 hours, gave her some elderberry tea, it's like sweet berry tea, and the condition completely resolved. No antibiotics, she's happy, smiling. She even made me like a little thing, I have it in my room now. So that's cool. Okay, so how do we implement this in the workplace? By eating all those foods, that's how we implement that. Okay. So the case where's Stacy at? Stacy? Hey, Stacy. Okay. So I work close with Stacy over at Control Tech. So this is our case study. So some of the challenges that we've had there are that there are 125 employees, and as Stacy touched on before, there's a myriad of languages. I think she said 7. And then, so that's a really big challenge. So as a result, I got Rosetta Stone, and I can speak all 6 languages now. It's really good. And then health education and health status. So a lot of people don't know their health status. A lot of folks haven't been to the doctor in several years. Ask them, when's the last time you went to the doctor? Oh, I don't know. And then there's a lot of misinformation, and people are not really informed about what health really means. I mean, in medicine, we're quite pathology-based. I'm sure you've heard, and if there's any doctors in here, one of the first classes that you take is that you go to Dead Lab. So you walk into a room with a whole bunch of dead people. This is your introduction to medicine. Walk in a room with a whole bunch of dead people. And we're really, really good at pathology. We got these diseases down pat. Every day there's a new name, we flip it around, a new drug, we have that. But as a naturopath and a holistic physician, and I think trying to implement this in the workplace, we're trying to understand what health really means. Not just the absence of disease or pathology. We got that down. We're really trying to understand what health means. So understanding, just because I don't have a headache this month, that doesn't mean that I shouldn't keep eating healthy. Just because I'm not hurting, that doesn't mean there still aren't things that I can do to keep this health status and even go beyond. Okay? So some of the solutions to these challenges that we have is having an interpreter. Nice job, Stacy, bringing that interpreter. Having screenings. So having these annual health screenings, and during these screenings, clearly explaining to the patient, this is what this screening means. When you come back, I'm going to explain this to you. These are the results of the screening. Just keeping up that education. So that kind of informs the patient and puts their own health back into their own hands, which is really, really the main point. Health coaching. Again, after they get the results back, they have a one-on-one screening, 30 minutes, explaining what all these labs mean. Latin is a funky language. Breaking down these words, breaking down this is the test for the liver. People are like, I heard this test for diabetes. What is that? Having someone there, either a physician or a health coach or a nutritionist who can sit down and clearly explain what this means. Having workshops. So we have monthly workshops over at Control Tech on different topics, just informing people about general status of health, about pathology, about disease. And this is changing the culture of Control Tech, I would say, because now people are talking about health all the time. I have lunch with these folks, and they're like, what are you eating? What's that brown rice? And when people see me, they run. If they have a donut or something, they're like, oh, let me get out of here. But, it's funny, but at the same time, it's good because it's causing them to be aware of what they're putting in their body. Okay? And nobody sits by me at the lunch table. Okay? And then having preventative care visits. We're going to try to implement this in the fall, where you actually can see your doctor on site at the workplace. So as a result of all this beautiful work, 78% of the employees report that they would seek medical advice from their on-site physician. That'll be me. Okay. And then finally, just driving this home, education is the biggest part. So that goes into one of the tenets. Doctor as teacher. The real goal is to not create a barrier between the doctor and the patient, right? You want the patient to know everything I want my patients to know everything that I know. This is not special information. And the more they know, then the healthier they are. And if that's the main goal, if the main goal is first do no harm, then I have to educate. Because I'm doing harm if I'm not informing my patient. This is what you need to do. This is what this means. This is why I'm running the test. Hey, I might be confused about some things. Let's think about that. Not try to have this veil of, doctor, patient, and whatever the doctor says I do. Keeping the line of communication totally 100% clear and open. Again, coaching, having those talks, and having some preventative care visits. Just a little side note that I want to talk about. Oftentimes we hear that, disease is genetic and pathology is genetic. And in some cases, this is true. In the case of breast cancer, there's some genes that we can clearly see that if someone has this gene, they're predisposed to having some type of cancer, right? But when we look at those chronic conditions, the overwhelming majority of them are not genetic. An example would be if my grandfather liked cookies and cakes and soda and coffee, and he made that all the time, and my father watched him do that. And as a result, my father